Okay, let's unpack this. We've got a whole stack of really interesting articles you sent over about white muscle disease in cattle.
Yeah, it's a fascinating condition.
Definitely. And we've dug through them, pulled out the key stuff just for you, our listener. Today, we're diving into this topic, white muscle disease. Sounds specific, maybe?
It does, a bit.
But trust us, it's actually packed with some really profound insights about, how basic nutrition can have these huge impacts on health.
Absolutely, it's foundational.
So our mission today, we want to get a real handle on what white muscle disease is, why it happens, what it actually looks like in an animal.
The clinical signs.
Yeah, and how vets figure it out, how it's diagnosed, and crucially, what can be done, treatment, and maybe even more important, prevention.
Right. And what's really striking, I think, is how something that seems relatively simple, like a nutrient deficiency, can cause such a wide range of pretty severe problems.
Especially in the young ones, right?
Yeah.
The calves.
Exactly. Especially in young, growing animals. It just hammers home how critical certain micronutrients really are.
Okay, so let's kick us off. For someone listening who's maybe heard the term but isn't totally sure, what exactly is white muscle disease?
Okay. So at its heart, white muscle disease is a degenerative muscle disorder. Basically, the muscles start breaking down.
Degenerative, okay.
Yeah. You might also hear it called nutritional myopathy or myodegeneration. Fancy terms, but they mean the muscle tissue is, well, degenerating, dying off.
And it mainly hits the young cattle, calves.
Primarily, yes.
Mhm.
Young, growing cattle, particularly calves, that's the main group. And the root cause is really the key. It's a deficiency, either selenium or vitamin E or sometimes both.
Selenium and vitamin E, okay.
And these aren't just, random nutrients. They're really powerful antioxidant.
Antioxidants, right.
Oh.
Can you maybe give us a quick sort of simple way to think about what an antioxidant actually does, like for the animal?
Sure, yeah. Think of antioxidants like tiny bodyguards, or maybe like rust-proofing for the body's cells.
Okay, I like that, rust-proofing.
Yeah. They're vital because they protect cell membranes from damage. There are these unstable molecules called free radicals floating around, causing what we call oxidative damage.
Right.
And selenium and vitamin E stop that damage.
Yeah.
So if you're deficient in them, those protective shields fail.
Ah, okay.
And that leads directly to oxidative damage hitting the muscle cells. The result, muscle fibers degenerate, they undergo necrosis. That just means they die.
Wow, so the muscle tissue itself is dying off.
Exactly. And it's not just one type of muscle. It can affect skeletal muscles, the ones they use for walking, moving around.
Uh-huh.
But it can also hit the cardiac muscle, the heart.
Oof, the heart too. Okay, and where do these deficiencies usually come from? How do cattle end up short on selenium or vitamin E?
Well, often it actually starts with the soil. If the soil is low in selenium, then the plants growing in it, the forages, the grains the cattle eat, they'll be low in selenium too.
Makes sense.
And there are definitely known areas for this. Parts of the U.S. Midwest, the Northeast, for example, they're kind of notorious for having selenium-deficient soils.
Right.
Vitamin E deficiency, that can happen too. Maybe just not enough in the diet overall, or sometimes if they're fed poor quality feed, maybe stuff that hasn't been stored properly.
Gotcha. So feed quality matters for vitamin E too.
Definitely.
Okay, this is where I think it gets really surprising. You mentioned it hits different muscles, and the articles pointed out it doesn't always look the same. It kind of presents differently.
Exactly. It's not a one-size-fits-all disease.
Yeah.
The clinical signs can vary quite a bit, which, can make spotting it early a bit tricky.
Okay, let's break that down. What about the form that's maybe more obvious, the skeletal muscle form? What does that look like?
Right, the skeletal form. This is where you see problems with movement, with locomotion. Calves might look stiff, weak, maybe they're trembling. They might have trouble just standing up or walking properly. Sometimes they get this sort of hunched back look. They might just not want to move, or maybe they physically can't get up. And if you actually feel their muscles palpate them, they might feel unusually firm, maybe swollen, or even painful to the touch.
So you can actually feel a difference.
Sometimes, yes. And this is the form we tend to see and diagnose more often, while the animal is still alive.
Antemortem, right?
Antemortem, exactly. But interestingly, even though they have these physical issues, the calves often stay pretty bright and alert. Their appetite is usually normal too.
Huh. That's interesting. They feel bad, but they still want to eat.
Pretty much, yeah.
Okay, so that sounds like a rough start for a calf. But then you mentioned the heart, the cardiac muscle form. That sounds, well, a lot worse.
It is, yeah, much more severe. When the heart muscle is the primary target, The signs are usually much more acute. They come on really suddenly.
Like out of nowhere.
Pretty much. You might see a very rapid heart rate, labored breathing, real difficulty getting air, sometimes a bluish tinge to the gums or membranes because they're not getting enough oxygen. And tragically, these calves can just collapse and die very suddenly from heart failure, often with almost no warning signs beforehand.
Goodness. And treatment is tough then.
Very tough. There's often very little that can be done for the cardiac type because it happens so fast and is usually fatal.
That's sobering. And I noticed in the reading there were even distinctions based on when it shows up, like timing.
Yes, precisely. There's what's called the congenital form. This affects calves right at birth or even before.
So born with it?
Essentially, yes. It can lead to stillbirths, unfortunately. Or calves are born alive, but extremely weak. They often just can't nurse properly on their own.
Oh, no.
And they might die within just a few days, maybe from starvation, or because they're so weak they pick up secondary infections. This seems to be more common if the mother cows were on, say, homegrown feed from selenium-poor pastures and didn't get proper mineral supplements during pregnancy.
Right, that link back to the mother's diet again.
Yeah, exactly. Then there's the delayed form. This usually hits calves a bit later, maybe between 1 and 4 months old. And interestingly, the signs often pop up after some kind of sudden, unaccustomed exercise. Like maybe when they're first let out onto pasture in the spring after being inside. That sudden activity can trigger it.
Wow. So the exertion brings it out.
It seems to, yeah.
And you mentioned another muscle group too, not just skeletal and heart.
That's right, the respiratory muscles, the ones they use for breathing. If those are significantly affected, the calf will show obvious signs of respiratory distress, difficulty breathing.
So it really highlights this isn't just about leg muscles. Selenium and vitamin E are critical for, well, all kinds of muscle function.
Absolutely. Heart, movement, breathing. It underscores how fundamental these nutrients are across the board.
Okay, so let's say a vet sees some of these signs, maybe stiffness or breathing trouble in a young calf, especially in an area known for low selenium. How do they actually confirm it's white muscle disease? What's the game plan?
Well, it's usually a combination approach. First, observing those clinical signs we talked about. The stiffness, weakness, maybe the breathing issues.
Right.
And critically, the animal's history. Is it a young calf? Are they in one of those known selenium-deficient regions? What's the feeding situation? That background is really important.
Okay.
But for actual confirmation, you really need lab tests. Blood tests are key here.
What are they looking for in the blood?
Primarily, they'll measure the selenium levels in the serum. In deficient animals, that level is often really low, typically below 0.05 parts per million.
A clear indicator.
Definitely. They'll also look for elevated levels of certain muscle enzymes in the blood, things like creatine kinase, CK, and aspartate aminotransferase, AST.
CK and AST. And what do those tell you?
Think of them like leak detectors. When muscle cells get damaged, these enzymes leak out into the bloodstream. So high levels of CK and AST are a strong sign that there's muscle damage happening somewhere.
Ah, okay. Indicators of muscle breakdown.
Exactly. And there's another really standard test, specifically for selenium status. It measures an enzyme called glutathione peroxidase, or GSHPX, in the whole blood.
GSHPX.
Yeah, GSHPX is a selenium-containing enzyme. It's one of the main antioxidant workers in the body that uses selenium. So, if GSHPX activity is low, it's a direct sign that the body doesn't have enough selenium to power its antioxidant defenses.
Got it. So low selenium, high muscle enzymes, low GSHPX builds a pretty clear picture.
It really does.
Now, what if the animal unfortunately doesn't make it? Can they confirm it definitively after death?
Yes, absolutely. A post-mortem examination, or necropsy, is very revealing for white muscle disease.
How so?
Well, just looking at the muscles, the gross examination, you'll often see exactly where the name comes from. The affected muscles can look pale, maybe streaked with white areas.
The white muscle?
Precisely. Those white streaks are areas of necrosis, the tissue death, and sometimes mineralization where calcium gets deposited in the damaged muscle.
Okay.
And they can also take a muscle biopsy, a small sample of the affected muscle, and look at it under a microscope. That's called histopathology. And that will show really clear evidence of the muscle fibers degenerating, dying off. It's quite definitive.
So seeing that damage really underscores, like you said, how important getting that diagnosis early could be.
Absolutely. Early intervention is key to potentially stopping or reversing some of that damage before it becomes too severe.
Okay, so that leads us right into treatment. If a calf is diagnosed, What can actually be done? Is there a way to turn things around?
Yes, definitely, especially if caught early enough. The main treatment is pretty straightforward. You need to get the missing nutrients back into the animal fast.
So, supplementation?
Exactly. Injectable forms of selenium and vitamin E are very commonly used. Products like BOCI or EC, you might hear those names, they provide rapid replenishment.
And those injections, they work quickly.
They get the levels up quickly, yes. And one injection can actually provide enough selenium for maybe up to 3 months, depending on the dose and product.
Okay, that's pretty effective.
Yeah. Oral supplements of selenium and vitamin E can also be used, especially for sort of longer-term management or for herds that you know are at risk.
Right. How quickly do the calves usually start showing improvement after getting, say, an injection? Is it instant?
Not usually instant, no. The response often takes a little time. You might start seeing noticeable improvement maybe within, say, 4 to 7 days.
Okay, so a few days to start seeing effects.
Yeah. And besides just giving the selenium and vitamin E, supportive care is really important too.
Oh, does that involve?
Well, think about it. Their muscles are sore, weak, so providing a really soft, comfortable place to lie down helps reduce muscle strain. Making sure they can easily reach food and water is critical because they might be reluctant to get up and move around to eat or drink.
Right, making it easy for them.
Exactly. Encouraging feeding and hygiene.
So with treatment and supportive care, what's the general outlook? What's the prognosis for these calves?
It really varies, and it depends heavily on which form of the disease they have.
Ah, back to the skeletal versus cardiac difference.
Exactly. For that skeletal muscle form, the one causing stiffness and weakness, if you catch it early and treat it promptly with supplementation, the prognosis is generally pretty good. Most of those animals can recover.
That's good news.
It is. However, for the cardiac muscle form, the outlook is much more guarded, often poor.
Because of the sudden heart failure risk.
Precisely. Because of that potential for sudden death from heart failure, treatment often just doesn't have enough time to work, or the damage is already too severe. So prognosis there is definitely not as positive.
Right. Which really, really emphasizes the need for prevention, doesn't it?
Absolutely. Prevention is, without a doubt, the best strategy when it comes to white muscle disease.
So what are the most effective ways to prevent this? What are the key strategies?
Well, preventive measures are absolutely vital, especially if you're in one of those regions known for selenium-deficient soils, or if you're feeding, say, home-grain forages where you might not know the exact mineral content without testing.
Right.
The core strategy really revolves around supplementation, making sure the animals get enough selenium and vitamin E before a deficiency develops.
Okay. And how is that typically done?
There are several ways. You can use mineral supplements mixed into their feed or provide free choice minerals. You can use feeds that are already fortified with selenium and vitamin E. Injectable forms can also be used preventatively, not just for treatment. And there are some longer-lasting options, too.
Longer lasting, like what?
Well, there are subcutaneous injections under the skin of something called barium selenate. That can actually provide supplementation for a good long while, maybe 9 to 12 months.
Wow, almost a year from one shot.
Yeah, it's a slow-release form. Or you can give an oral dose of sodium selenate that usually lasts more like 1 to 3 months.
Okay.
And there are even these interesting things called intraruminal boluses. They're like dense pellets, sometimes made of soluble glass, that sit in the rumen, the cow's first stomach compartment.
A bolus in the stomach.
Yeah, and it's designed to dissolve very slowly over time, releasing selenium gradually for maybe 6 to 12 months.
Huh. That's quite clever. Different delivery systems for different needs, I guess.
Exactly. You've got shorter acting options like oral dosing or standard injections, and these longer acting ones like barium selenate or the boluses, which can be really practical for managing larger herds or reducing handling frequency.
Right. What about just adding it to their main feed ration?
That's definitely an option in feed supplementation, adding selenium and vitamin E to their concentrate ration. It can work, but sometimes it's a bit less reliable.
Why is that?
Just because individual animals might not always eat the same amount of the concentrate feed every day. So their actual mineral intake can be variable. Some might get enough, others might not.
Ah, consistency is key.
It really is.
So those are ways to supplement the animals directly. But you mentioned earlier the link to the mother cow. Is there anything done pre-birth for the calves?
Yes, and this is a really crucial point. Supplementing the dam, the mother cow, during her late pregnancy is a very effective preventive strategy.
How does that work?
Well, selenium can actually cross the placenta from the mother to the developing fetus. So if the mother has good selenium status, the calf gets a good supply before it's even born.
Okay, starts them off right.
Exactly. And then both selenium and vitamin E get concentrated in the colostrum. That's the first milk the cow produces right after calving.
Right, the really important first milk.
Super important. So if the dam is well supplemented,
Mm.
her colostrum is rich in these nutrients, giving the newborn calf a vital boost right at the start of life. It really shows that thinking about the mother's nutrition directly impacts the next generation's health.
That's a powerful connection. Beyond supplements, anything else on the prevention front? Feed management.
Absolutely. Good feed management is key too.
Yeah.
Making sure you're providing high-quality forage and grains, ones that naturally have adequate levels of vitamin E, is important. And, critically, avoiding feed that's gone bad. Moldy or spoiled feeds should definitely be avoided. They can sometimes contain substances, mycotoxins, or other things that can actually destroy or deplete the vitamin E in the feed or interfere with its absorption.
Ah, so bad feed can actively work against you, even if the original feed was good.
Precisely. It can counteract your best efforts. So proper feed storage and quality control are part of the prevention picture too.
Okay, this has been really illuminating about white muscle disease itself, but what really struck me from the articles is that the impact of being low in selenium and vitamin E, it goes beyond just this one specific disease, right?
Oh, absolutely. That's a critical point. These deficiencies don't just cause white muscle disease. They can have much broader, often sort of hidden negative effects on the whole herd's health and productivity. They can be flying under the radar.
Like what kind of effects?
Well, for example, they've been linked to decreased fertility in cows, trouble getting pregnant, lower conception rates.
Okay, that's a big economic impact right there.
Huge. Also, compromised immune function. Animals deficient in selenium and vitamin E are often just more susceptible to other diseases, pneumonia, scours, you name it. Their immune systems aren't working at full strength.
Right, less able to fight things off.
Exactly. In cows that have just calved, deficiency can increase the risk of retained placentas where they don't expel the afterbirth properly.
Huh, another health issue?
Definitely. And overall, you can see increased calf mortality, even beyond classic white muscle disease, and reduced weaning weights. The calves just don't thrive as well.
So fixing that selenium and vitamin E status isn't just about preventing WMD.
Not at all. It's really about supporting the fundamental health, the immune system, the reproductive success, and the overall productivity of the entire herd. Prevention really is a powerful investment with wide-ranging benefits.
Wow. Okay, so we've really taken a deep dive here into white muscle disease. We've unpacked its causes, which seem simple nutritional deficiencies but have these really complex effects.
Yeah, surprisingly complex.
We've explored the different ways it shows up, those varied clinical forms, some quite devastating. And we've covered the crucial strategies for diagnosis, treatment, and especially, as we just discussed, prevention.
And I think this discussion just perfectly underscores how incredibly vital these seemingly small things like selenium and vitamin E really are. They're needed for basic biological processes.
Right, the antioxidant role.
Understanding that role, how they protect cells, and how their absence can just cascade into these severe health problems, especially in young animals. It's a really profound lesson, I think, in biology and just the delicate balance required for health.
It really is.
It's also, a powerful reminder that sometimes these major health crises in livestock can be traced all the way back to something as fundamental as what's lacking in the soil. It highlights that interconnectedness between the environment, the feed, and animal health.
That's a great point, that connection to the very ground they stand on. So for you, our listener thinking about this, how might understanding the critical role these micronutrients, these antioxidants, play in protecting animal cells? How might that connect to broader ideas, maybe concepts of cellular protection, disease prevention, and other areas? Perhaps even things relevant to your own health journey or understanding. Definitely something to think about. What insights do you take away from this deep dive?